Hi, Dr. Jamie Shick here at Simply Wellness Chiropractic. So we're going to talk about the difference between whiplash and concussions. It's important to know the difference because there's some signs that are serious injury and some that are not as serious. So the way they occur is very similar. Usually from auto collisions, contact sports, slips, spills, trips, falls. That can all be common injuries that can cause concussions or whiplash. So we're going to go talk about whiplash first. Whiplash, the normal area that it affects is the neck and the top of the shoulders. Most common thing, why? Because it's a lot of flexing and bending from the impact. Also affects a lot of the upper cervical area because all the ligaments are in there, but it can affect anything. Why? That constant force from hitting back and going forward, it can stretch the ligaments in your neck, causes instability among other things. Common symptoms you have with this, well, you can have a very stiff or painful neck, very common. You don't have much range of motion, so you might be looking one side or the other, and it's just painful to turn, feels like it's locked up. You don't want to move it too much. Painful neck, when you touch it, it's like, ooh, everything's so sensitive and sore. That's very common. And headaches that occur basically at the base of the skull right here. That's also very common. The type of injury, when you have a whiplash, it can be hard to work, it can be hard to exercise, it can be hard to do simple things. If someone mentions your name and you look back real quick, it hurts the neck. The things that we want to look at when we're looking at the neck, we want to make sure there's not a lot of instability in the neck, and we also want to get on it as soon as possible. Now when we start taking care of it, we usually start with conservative treatment and work into it a little bit more, especially for adjustments, because we want to ease into it because there's a lot of damage, a lot of inflammation when you first start. And then we'll slowly get into the adjusting after that. The nice thing about starting sooner than later is because most injuries, when you get them, they'll last for, it can be weeks to months. And then sometimes it resolves on its own, but a lot of people have long-standing injuries that deal with this. And you can have symptoms up to 10 years. Why? Because there's irreversible ligament damage in the neck. So it's good to do this. The faster you get on top of it, the more we can get that healed up and see how far we can get you to prevent long-term problems. So that's whiplash. Next thing's concussion. Similar injury, like I said, auto collisions, contact sports, hitting the head, all kinds of things. While whiplash deals with mostly the neck and shoulders, concussions deal with the brain. Now, when you get in a concussion, there's things that you gotta watch out for, especially if you lose consciousness right away. That's one of the biggest things. If you lose consciousness with a head impact, you get seek medical attention immediately. That's a serious sign if it knocks you out, because that means the brain was impacted, knocks your lights out, boom, time to get checked out immediately. With any of these injuries, always get checked out immediately to rule out. Common symptoms that you have with a concussion, well, you can have confusion, you see that. You can have tiredness all the time, or it's just you don't feel like you want to wake up. You can have mood changes, behavioral changes, headaches are a big thing, and you can have cognitive decline. That means you're just not yourself, you're not fast anymore, you're slowly, you just can't make out words, everything's slowing down, and you can't express yourself, your forgetfulness. It's a serious thing because it is a traumatic brain injury. Now there's a fluid that surrounds your brain and the skull there, and when you get an impact, basically you can disperse that fluid. The brain can hit the front of the skull, the brain can hit the back of the skull. It just depends on how the impact happened. It can cause brain bruising. It can cause those fluids in your brain to be dispersed unevenly, and that can cause all kinds of problems because you're dealing with the brain. So that's why you have all those different kind of symptoms that you have. Like I said, go get checked out right away if you experience any of those, because you just need to rule out. The thing is, no matter which injury you have, whether it be whiplash or concussion, a lot of them go hand in hand. If you have a concussion, usually you have whiplash. They come hand in hand because it's a constant force on your neck. Great thing is chiropractic helps with both of them. Whiplash, we say it all the time, very effective with that. But how does it work with concussion? Of course, first, seek immediate attention, get under care right away and get it stabilized. Then you're gonna have lingering symptoms, usually with concussion. You're gonna have neck pain, you're gonna have headaches, you're gonna have other things go on as well. That's where chiropractic comes in. We can help manage your symptoms, make you function better, because it all deals with the nervous system and the brain's affected. We gotta keep everything flowing and going as we should. So we can manage those symptoms as your body's healing. So does that make sense? We want to manage symptoms as your body's healing. We're not trying to cure anything, we're not trying to cause anything to reverse it, it's just managing everything while your body's healing. That's the end result. So even though both the injuries kind of happen hand in hand, depends on, you just want to get checked out just to make sure it's not a serious one. So always get checked out. Then once we know it's not life-threatening, we'll come in, we'll get you checked out, evaluate you 100%, and then start care from there. Thank you for watching my video. If you have any questions, you can always call. You can always check out our website.